Welcome everyone to Volunteering for Seniors virtual webinars for senior citizens and their caregivers. Good morning. This is Pratima Penumarthi, founder and president of Volunteering for Seniors, a 501c3 organization. Our mission here is to reduce loneliness and isolation among seniors and help them stay more energetic. We are aiming this and making sure that seniors blend into their communities without any difficulty. We are achieving this through our meaningful volunteering and through our dedicated volunteers, and we're all dedicated here to improving the lives of seniors. Since the beginning of 2021, we have been conducting webinars, virtual, in-person talk shows, conferences, keynote presentations, general sessions, all that basically focuses on supporting health and self-care for seniors and caregivers of senior adults, and even individuals with or without dementia. So one can learn more about our organization by just visiting our website, volunteeringforseniors.org. Coming to today's main topic, the Medicare annual enrollment period, everyone knows, has arrived, AEP, and millions of newly eligible Americans are now in the process of deciding which coverage options make the most sense of them going into 2023. So if you are among those currently enrolled in Medicare, don't let this opportunity to change your coverage pass you by. To talk more about this and give us more knowledge about the open enrollment, we have with us Kathy Chianca, who's currently the regional director for the SHINE program, SHINE, which is serving the health insurance needs of everyone in this area. And of course, in the area of the entire Canton, the entire of the, HESCO, which is basically based there, and Kathy will be the right person to talk about that. She also, she was a volunteer for the SHINE program for 4 years prior to even accepting the directorship position at the HESCO office, which is currently now located in Walpole, Mass. She joined this program after retiring from her 20-year-old career as a certified financial planner and vice president of a small boutique investment management firm in Boston. Welcome, Kathy. We are so happy to have you here with us today.
Thank you, thank you, thank you. Hello to everybody on this. I hope it's beautiful here. I hope it's beautiful there, wherever you are. Yeah. Thank you. As Pratima, if I mess up your name, please let me know. Has invited me to this. This is my first sort of Zoom presentation to the general public. I have done many in-person presentations. So this is the first time my technological skills, which are limited, are going to be challenged. So please be patient with me. I am going to be the screensaver. So as Pratima has said, the SHINE program is the acronym for serving the health insurance needs of everyone. But there should be a little caveat to that to everyone on Medicare, whether you're aging into the Medicare system because of 65, or you on Medicare due to a disability. Because you can be under 65 if you've been disabled on Social Security disability for a 24-month period, you are eligible no matter what your age is to be on Medicare. So it should have that little bit of a star next to the SHINE. Medicare is our basis, okay? Medicare, I work for an organization called HESCO, which is the Health Education Social Service Consortium. It encompasses 12 towns in the Norfolk County region. But the SHINE program that I am the director of far exceeds that. I have 22 towns that I'm the director of the SHINE Counselor program, all the way down to Situate, Norwell, Cohasset, all the way down the South Shore. And then you come back up this way, Millis, Medfield, Plainville, and a lot of the towns in between. So any one of the towns, we have counselors at those council of aging locations that anybody can make an appointment with. They need a little more information, a one-on-one session. You can call your local council of aging and schedule a SHINE appointment. All right, so that's just sort of the general. The SHINE program is actually a federally funded program under some regulation called SHIP. And I don't even know what that acronym means. The SHINE program is funded by the SHIP. It's left to do the direction of each of the different states to run the program under certain regulations, but every state is different with what insurances are available and how their systems run. So the funding comes to the federal, down to the state, and then the state breaks it down by region. So it's a multi-layered facility. And the SHINE program has 600 volunteers that run that do all the services to the individuals out there in the community. Very few people within the SHINE program do have any kind of salary. It's basically a volunteer program. So the SHINE counselors in 9 out of 10 cases are as an unpaid volunteer. And they have to be trained and retrained and certified year over year. As Pratima had mentioned earlier in our conversation before you guys were allowed to join, it's ever changing. There's always something going on. Just because you think you got it down pat today, just like what happened in August, there's new regulations and it changes and it trickles down to any number of things. So the presentation that I have going to be using for this is actually the presentation that I just used on Thursday to start to retrain some of my counselors with what's happening new. Because of that, the regulations and the Inflation Reduction Act and what they call the Bennies Act, it has changed multiple things within the Medicare plan. So I'm going to ask anybody who has specific questions to put them in the chat, and we may answer the questions as they come along. If it's something, Pratima, I don't know if you want people to raise hand if it's something that needs to be clarified at that moment. So you can do that and just let me know, because I don't see any of that on my screen.
Right, yeah, we can see that. So if anybody has any question, they can actually put in the chat box. That will be great, so that even if I miss, we can know that there's someone having a question. Yeah. Okay,
I am now going to share my screen. Is that okay?
Sure.
Okay. So I've already introduced the front screen, which is SHINE and the acronym, the goals of the SHINE program. Let me move this little thing out of my way. The goals of the SHINE program, the object is to provide Massachusetts residents, because like I said, every state has got their own rules and regulations and insurance that's available. So we are here to provide Massachusetts residents with Medicare access to the most current, accurate, and unbiased health insurance information counseling free of charge through these trained counselors. We as counselors, should never make the decisions for an individual, though many, many, many times when we're doing a one-on-one conversation with somebody, more often than not, somebody will say to us, what do you think I should do? And we actually cannot tell you what you should do. Sometimes I sort of get around that little rule by saying to somebody, if you were my Aunt Margaret and you were sitting across the table from me at dinner, and I would say to you, Auntie, why would you want to go that route when this other plan seems so much better? In hopes that I can steer somebody into making the better decision for them without telling them exactly what to do. Right. Okay, and we are to be prepared to assist the beneficiaries with whatever plan they do enroll in. We can assist with all of that, because there's many ways. There's phone calls, webinars, going online. So there's many ways to confuse individuals as how to get their enrollment process done. All right. You don't need to know that. Like I said, this is a presentation that would be given to some of the counselors. So this is information sometimes that you may not receive. We have to ask somebody if you were going to come in. There's certain things we can and cannot do. If you have a retiree plan through a company, or you're on federal benefits or veterans benefits, sometimes we don't have enough of that individual information about those plans to assist you to make a real decision. We are here to provide the information that's available on a general public plan. A company may have little caveats within their plan that we don't know about. So we, in most cases, would recommend that person go back to their plan, get a printout of everything, if it's at all possible, that the plan has, that we might be able to do a comparison. But in most instances, we would not have somebody change from one of those type of plans, as if you leave that plan, it's very difficult to try to get back in. So we would not always do that for somebody. And one of the explanations for part people don't understand is the differences between Part A and Part B. So that's one of the things we sort of give in what we call a Medicare 101 presentation. And if you were to, if you need that sort of information, you could provide Pratima with your email address, or in other cases, an actual hard mailing address, a land mailing address, and we can send you the Medicare 101 information packet that will be prepared for 2023, because right now, during this week, all of that information is just starting to get compiled. The finished product is not available today, but it will be in the near term. Okay, so I'm going to go down to the next. Open enrollment, as Pratima had mentioned earlier, is a very important time of the year for people who are on Medicare, who need to review their prescription coverage or their health coverage to make a change. It's the annual enrollment between October 15th and December 7th. For Medicare, you see the differences. Medicare is Medicare. That's to change to a prescription plan. Medicare Advantage are a type of coverage, and we can go further into the Medicare Advantage plans later on. But if you were to decide during regular open enrollment to opt for a Medicare Advantage plan, there's a lot of homework that we recommend you do before you make that decision. The main thing is to make certain that your primary care, if you want to stick with that particular primary care or specialist, actually take that plan, because those are mostly network specific. They may be less in premium and coverage, but if your doctor is not enrolled in that particular Advantage plan, you would have no coverage. So there's homework to be done before you make that decision. But many people, before they go to the Shine Council, will opt to take a zero premium plan that they see being advertised on TV. Does not always work out to their benefit, because you'll buy that zero premium plan. Your doctor's not in it, but you don't know that till you go to the doctor in February. So luckily, there is now, only this is the second year it's available, a Medicare Advantage open enrollment, which begins January 1st to March 31st, to undo any errors that you might have made during the open enrollment period. So again, a one-on-one presentation before you make the decision which way to go. Federal employees have between November 15th and November 14th and December 12th to make the plan on that end. And Health Connector plans, the open enrollment is November 1st to just January 23rd. Health Connector plans are usually for people who do not have premium free Part A, and we'll go into that further on one of the other slides, or are under 65, and maybe they have a couple of kids, but there's no job. They can buy their health insurance on the marketplace. So that's called the Health Connector. Okay. And one of the things, and I don't know the audience, can you take a survey, Pratima, on the audience? So before I go too deep into this, do we have people here who are under 65 and considering going on Medicare because they're approaching 65, or do we have everybody that's already on here? Because this enrollment period doesn't do anything for somebody who's already on Medicare.
So I think we can ask the question right now.
Okay.
If we can take a break for 1 minute and check with our with our viewers, if anybody wants to answer to what Kathy said.
Hi, my name is Amurthy Gudipudi. I'm 53 years old, but I don't have any plan for Medicare enrollment. But I joined this session to for the knowledge purpose, understanding and what is the Medicare and how does it work, and any information which can be useful for my future, at the time of enrollment, how I can plan it,
Sure.
just an
Did
education
I hear you say 53?
Yeah, he's
I'm
53,
53.
it's just going to gain knowledge like how I'm doing, like we
Yes.
to get more information. But Naranji and Subhashji, is there anything that are you already joined with some plans, or do you want to just clarify to what Kathy said?
This is Subhash here. I'm 75. I'm new here and I'm right now on healthcare, health connector rather.
Okay.
Pretty soon, I think I should be joining Medicare. So I thought it should be useful for me.
Okay, again, this is the initial enrollment period. This is for somebody who's turning 65. I wish that I would be able to give the 53-year-old some information, but by the time 53 turns into 65, I have no clue what is going to, the changes that are going to be made before then. So if you were going to, I'm just going to pretend that you're going to be turning 65. So this cannot be taken as what's actually going to be around in place when the 53 is beginning to turn 65. So right now, if your birthday was July 4th, that's your 65th birthday. This is what this slide is representing. Medicare, you could enroll, you'd have to call Social Security. That's how you enroll in Medicare, by calling Social Security. It's not really what you think of, but it is. The Social Security information would take the application for your Medicare, whether you choose to join Medicare Part A, Part B, a combination of both, or either or. Social Security is where you start. So if your 65th birthday is July 4th, under current regulations, that's why I think things change. Medicare, you would be able to call Social Security anywhere between the months of April, May, or June to start your Medicare on July 1. It always starts on the first of the month of, no matter when you sign up, if it's the 15th, the 20th, the 2nd, it's always the first of the following month. Always starts on the first of the month. So you could join anywhere there. The month of July, you can join because that is your birth date month. It would be the first, or you can wait August, September, and October. So under current regulations, if you wait for the month after your birthday, you have to wait another month before it actually begins. That's why I'm saying to understand it, I'm going to go to the next slide. Under the new act that just came on board in January of this year, they have changed that your initial enrollment period would be the following month, no matter what. There's no longer waiting the extra month. So again, I say out to the 53-year-old, we don't know what's going to change from now till then. This is how it currently is, okay? They now have expanded it for anybody who's had a kidney transplant, even though you might be under 65. If you are under 65, there's one of the diseases that allow you to join Medicare under 65 is called end-stage renal disease. There's no questions, you're on it. So if you've had a kidney transplant, after 36 months, you can now buy a Part B plan to cover the drugs that you need for your transplant. That is brand new in 2023. And one of the other slides later on, we'll go into it a little bit more.
Yeah, Kathy, I have a quick question here.
Yeah.
Sorry to interrupt. You just mentioned about the expanded coverage for kidney transplant patients after 36 months, right? But what about the patients? Because I know there are a few patients who are less than 55, but who are undergoing the kidney, they're still waiting for the donors, right? So
Yes.
do they still come under this? I mean, do they also come under?
If you have end-stage renal disease, you can go on Medicare, no questions asked.
Yeah.
All right. But then after the transplant, and you're kind of, hopefully, if all's gone well, you're up and running and you're back to full speed and you go back to your employer, you may not be able to get coverage for those immunosuppressant drugs that are going to go forward. They have now allowed you to buy a Part D plan that will cover those drugs. That is brand new for this year. So we can go further into it on an individual situation, okay? And there's these other, you know, the colorectal cancer screenings, polyps, there's all these little caveats of things that unless you are working with somebody in this specific situation, I'm not going to go into any further. You just know that it's out there. And if you come across this type of situation, you need assistance, contact Shine. They will help you work all the way through. And again, this is one of the new pieces. This just came on board. We were just given this information on October 11th. The counselors and myself have not digested all of it at this point in time, but be aware that it is out there now. Under the new Inflation Reduction Act, which just happened in August, the changes that are going to immediately impact anybody on the Medicare plans are the prescription plan. PDP means prescription plan, all right? And what's the acronym? I've actually lost it. I say PDP without thinking of it. Provide a drug plan, or that provide a drug plan. And the MA stands for Medicare Advantage prescription plans. And that's with the new insulin. Now that's going to cause a huge ripple into what people have in place and what they need to go in place. And again, it's one of those things that all of the Shine counselor and the public is going to pretty much be banging their head on the wall trying to understand, because they made this cap, but they did not mandate that all insulin is under this cap. So we have to find out which insulins are going to be covered, which plans are going to be covered at this max. So again, I hate to just sound general, but unless we were talking to somebody on a one-on-one that we could actually dig into the real depth of what their coverage needs, it's going to be a horrendous task for everybody to try to put this all together. There's two different types of insulin. The insulin that you take at home is covered under a PDP. If you have to go into a doctor's office or a hospital environment to get your insulin, it's covered under a separate part of Medicare called Part B. So again, it's one-on-one situations where we could dig down and find out exactly what somebody's situation and what changes should be made. Another one of the things that are coming through very, very quickly due to this Inflation Reduction Act is the Shingrix vaccine. In the past, the Shingrix vaccine has been not covered under many of the Part D plans, the prescription plans, or if it was subject to the plan's deductible. So you'd go to get your 1 or 2 Shingrix shots and you might have to pay $150 to $220 for that shot because it was not covered by the deductible. That's something that's changed. So if anybody has not had their Shingrix shot and is looking for a plan in 2023 so they can get that plan, get that shot, that is something, again, speak to a Shine counsel directly and go into your plan knowing that's what you're looking for.
Kathy, before we
Yes.
go further ahead, there is a quick question by Subhash Kamath. He just asked, I don't know whether it is a part of this or you'll be covering the next part. Like he says that my wife was on Health Connector till about a couple of years ago. She had then applied for Medicare. She has got Medicare Part Part B, but not Part A yet. How do we go about getting Part A too?
Part A, you have to have a certain number of quarters to be eligible for free Part A paid into the Social Security system. If you're not eligible for free Part A, that is why you're probably still on the Health Connector. Part A is very expensive if you don't have enough quarters. I'm just flipping through some pages I have right here in my lap. to find out what those, to get that number. I believe if you don't have quarters between 1 and 30 that you worked under the Social Security system, or somebody has worked under Social Security on your behalf, I think that the Part A premium is about $499 a month.
Wow, that's big.
Yes, yes. Yes, and if you had between 30 and 39 quarters paid in, it goes down to about $299. But it's very expensive to have the Part A if you don't have enough quarters in the Social Security system. So had the application, again, it would be a one-on-one conversation. Had the applicant applied for Part A and been denied for free Part A, or where are they in that process?
I see. Yeah, no, I am not quite clear because my daughter has been doing that, but I'll check up with her. But I guess it has been denied. So I'm not too sure whether my wife is still on Health Connector or not.
Yeah, so how long ago was it denied?
I presume it was about a year ago.
Okay, and have you worked, or has she worked to add more quarters to that, to maybe attempt to apply again?
No, not really.
Okay.
But honestly, we don't mind paying for the premium also. So how do we go about that?
Well, I'm just, again, in this Medicare 101 that I'm putting together, I'm just flipping through those pages now, and that Part A premium has now jumped in 2023 to for anybody who's got 0 to 29 credits within the Social Security system to $506 a month.
Oh, I see. That's pretty stiff.
Yeah, it's pretty stiff. And if you've got between 30 and 39 credits, it's now going to be $278 a month.
I see.
All right.
Okay.
So I don't know on the Health Connector if you are paying a premium for the plan that you're in, but the only reason somebody over 65 who can stay on a Health Connector plan is because they don't have free Part A. Other than that, you would not be able to, if you're eligible for Medicare, you're not supposed to be able to stay on the Health Connector unless you're in the situation where it's, you have to pay for Part A.
I see. I see.
Okay.
Okay. So I presume my wife would still be on Health Connector.
Most likely until she can be on Medicare under yours if you've got more than 40 quarters.
Not yet, because
Not yet. So put that on your calendar. Watch for that. 40 quarters is 10 years on the Social Security site.
I see.
And then you would be eligible for the zero premium Part A.
I see.
Okay.
Okay.
All right.
So let me digest this and I'll get back to you in case I have more questions.
Yes. And to further go into this implementation of some of the changes that are taking place due to this Inflation Reduction Act that are not happening in the actual calendar year 2023, here's a little bit of things that are going along further. And that's why I said, again, to the 53-year-olds, I cannot give you specific as what's going to be happening at that point in time. Each of these changes will be implemented down the road, and who knows what will be happening even after this, okay? But we need to concentrate right now on only what's happening in 2023. One of the things I've learned living 70 years is I don't have control over everything. I can only manage what I know for this particular calendar year, okay? So some of the companies now, these Medicare Advantage plans will pay rebates if they on the drug prices. So if the drug costs $100, I'll make things simple, and they've been charging $150 with the new prices, they're supposed to have to rebate people the additional money. How it's actually going to work, I've not seen an example of this, but they are supposed to start rebating the individuals for anything over the cost of inflation. So I don't know how it's going to work. I wish I had the crystal ball to see how this is. I have been in this sort of business long enough to make this is a biased assumption, even though I'm supposed to be unbiased. The people who put these things in place have no clue. They've actually never been on the ground working these things out. So that's just my opinion. The cost of the insulin, see, they make it sound like all insulin. So now everybody thinks their insulin is going to be $35. No, specific insulin, select insulin. And select insurance company opted to be in this plan. So it's not a one size fits all across the board. Again, individual insight into your particular situation is what needed. A Shine counselor, a visit with a Shine counselor, or a phone call to do a phone appointment or a Zoom appointment is what I recommend. Reduces the cost and improves coverage in adult vaccines. Again, that's that Shingrix, not being part of a deductible. I'm not going to go forward again to each of these different years. We're breathing today. We don't know where we're going to be in 2024.
Mm-hmm.
All right, here we go. This is more specific information that addresses each of the individual's needs. The premium part A, oh, I just went, can I go back? How do I go back? Page back, okay. Premium free part A. If you have the quarters, we've already gone through those and I've already told you what the 2023 prices are going to be. Part A under Medicare is hospital coverage. And that is only if you're inpatient hospital coverage. That's one of the things that you have to advocate for yourself. Should you be hospitalized, to make certain you are considered inpatient and not in there for observation. You could be in for 4 or 5 days observation. Medicare doesn't pay for that. You have to be inpatient. So you have to make sure you advocate for yourself that you are labeled at the hospital admittance as inpatient. Very, very, very important. Because if you're on Medicare, your Part A hospital deductible for 2023 is going to be $1,600 per benefit period. A benefit period in the world of Part A Medicare is 60 days between hospitalizations. For an example, if you had too much to drink on New Year's Eve and you ended up in the hospital on January 2nd, the billing department's going to be following you in looking for 60, and all you have is your Medicare Part A. They're going to be following you looking for the $1,600 you owe them right off the top. If everything is well and you go home after a few days, you don't get readmitted for some other strange thing until July, you now have to pay that $1,600 again, because it's been more than 60 days since you were hospitalized in the previous. So if you were hospitalized in January and then again in February, the $1,600 is mitigated. But if you March, April, May, June, July, you're going to pay the $1,600 again. Now, this is where the individual has to make the assumptions and the decisions on how they're going to supplement that so they don't have to pay that. But if all you have is Medicare Part A, that's what you're going to be facing. And again, it shows you that the 0 between the days 1 through 60, then the benefit period would start all over again. SNF is skilled nursing facility. So for day 0, you pay 0 between day 1 and 20. So if you went in for a hip surgery and then you had to go to the skilled nursing for a little bit of rehab, you don't owe anything for days 1 through 20. But starting on day 21, you have a copay of $200 a day. So again, this is how you have to supplement your coverage by buying other insurance. We haven't gotten to that point. This is just Medicare A and B. The premium for Medicare Part B, which is doctors and durable equipment, has been reduced by a couple of dollars for 2023 to $164.90. For the average individual, it is an income-based number that can fluctuate. The IRMA, the income-related monthly adjustment amount, would add to your income, to add to your premium if you had incomes, whether you're single or married, it would kick in after $194,000 for a married couple. Income over that in a year would bump you to the next level. That's called the IRMA adjustment. And that can go all the way up to $560.50 a month per person for somebody who's got the big bucks coming in over the course of the year. The Medicare 101 packet that I mentioned earlier will have those dollar amounts, will have those ranges, okay? Part B deductible. The Part B deductible has also been reduced for 2023 by a few dollars, and that's $226, and that is an annually deductible. Annual deductible. So that would be if you went to the doctor's and the doctor's office visit was $100. Medicare is going to get the bill submitted to them. Medicare is going to approve what they believe is the doctor's office visit. And if, let's say, they approve $80, the doctor in Massachusetts, other states is different. In Massachusetts, cannot bill the individual for that $20 that Medicare did not approve. It's off the table. And then Medicare, if you have Part B, is only going to pay 80% of their approved dollar amount. So they're not going to pay the full 80 that they approve. They're going to pay whatever it is, $169, whatever it might be, until, and the rest of it is your responsibility until you reach an annual out-of-pocket of $226. And then that's all that you'd be expected to pay, okay? Unless you have additional coverage. All right, I'm going to go to the next screen. Now, there are ways, two different ways to cover that 20% that Medicare does not cover after they've approved the charge. I'm going to flip through these Medicare Advantage plans right now, and I'm going to go to the easy way first. I'm going to take the easy way out. All right. Let's see. Those right here, those are called Medigap plans. Very easy to understand the terminology. We cover the gap that Medicare doesn't pay. In the state of Massachusetts, and again, this is all part of our Medicare 101 packet, listing all the names and the prices. In the state of Massachusetts, there are 7 companies that have been allowed to sell these type of Medigap plans in the state of Massachusetts. By both federal and state laws, every one of these plans must cover exactly what Medicare covers. So you don't have to go shopping in these plans to see, does this one do this? Does this one do that? They all cover exactly what Medicare covers. The 20%, that's what they cover. So, but what they don't have to have is the same price. And the prices can range. There's a probably $100 to $150 discrepancy between the 7 different companies with what they charge for exactly the same coverage. So as a consumer, your homework is to do the best for you and sort of make a good decisions. In my own opinion, again, here I am unbiased, but I have my own opinions. I don't see why I'm going to pay $312 for exactly the same thing I'm going to get from another company for $190. That's just sort of logic. But anyway, they can sell them, they can charge their own prices. All right, so there's 3 different levels of Medigap: the core, the supplement 1, and the supplement 1A. The core is the least expensive of all the plans. What it does not cover is that $1,600 that we talked about for the deductible for Part A. It does not cover the $226 deductible for Part B. And it does not have any of that skilled nursing coverage. So you're paying a much lower premium, like I'm going to say on the average of $100 to $110 a month. It pays the 20% of the hospital charges, doctor charges that Medicare doesn't cover, but it will not pay the deductibles or have any skilled nursing coverage. Supplement 1 is the plan that was available prior to 2015. But you cannot join that plan if you were not 65 before January 1st of 2020. It is the most expensive of all the Medigap coverages. But if you're just turning 65, it's not even an option for you. Supplement 1A is what was replaced Supplement 1. And the only difference, other than the premium difference, the only difference between the coverages in the two plans is Supplement 1 pays both the hospital $1,600 and the Part B $226 deductible. Supplement 1A, the only thing it doesn't do is cover the $226 Part B deductible. So again, if you sit down and do your math, you're paying for Supplement 1 probably about, on the average, $400 more over the course of a year to save $233. Maybe at some point, if the Supplement 1A premium jumps, that sort of, the difference will go away. But for right now, it's the way, in most instances, it's the way people make their decisions, Supplement 1A.
So Kathy, I have a quick question there.
Go ahead.
In Supplement A, could you just come back to the Supplement 1?
1, yeah.
Supplement 1, you said that if somebody is admitted in the hospital, like about the 1,600, even that is covered,
That's
right?
covered, yes.
It's covered. And it also covers the one which you said about the Part B thing, where
Yes.
26, right?
It
So-
covers both deductibles. The Supplement 1 and the Supplement 1A cover the hospital deductible.
So it's more, you're saying that it's more sensible to take Supplement 1 rather than taking Supplement 1A, no?
No, absolutely just the opposite.
But why is that? Because there may be a situation that may happen that he or she is hospitalized.
Yeah, no, it covers both the hospital. The Part B deductible is only $226, and that's the doctor. It covers, both of them cover the hospital deductible.
Okay.
They each cover the $1,600 hospital deductible. Supplement 1A does not cover the Part B deductible, which in 2023 is going to be $226.
So you're saying
The Supplement 1 policy premiums is going to cost you $400 more a year in premium.
Yeah.
To possibly save $226. Coverage is exactly the same except for the 226.
So Supplement 1A is more beneficiary.
It's it's better because the premium is a little bit less. You might have to pay $226 out of your pocket sometime throughout the course of the year. It's not a given. But on Supplement 1, you're going to pay $400 more a year in premium to possibly save that $226.
Okay.
Okay, we can go. We can go further in different questions. Now, the second way to cover your. Oh, so I'm going to go further. Okay, if you do go the Medigap route, which the type of plans that we just went over, none of them cover prescriptions. You have to buy what they call a standalone prescription coverage, a Part D plan. Okay, Part D plans, and I believe in this particular calendar year, there are going to be 27 different drug plans available in the state of Massachusetts. The Part D plans, most of them have a deductible, and that's built in. You can see here on these are not the individual plans. This is the general standard benefit. The deductible has been raised from $480 to $505. Not all meds are in the deductible phase. It's usually medicines that are in the tier 3, 4, and 5 that are in the plans, the specific plans deductible formulary. The initial coverage limit And now that it is a term that's very difficult to understand. What it is should actually make it much easier to understand is it should say retail cost. Every med that we take has a retail cost, even though that's not what we may pay when we pick them up, they actually have a retail cost. I'm going to make I'm going to pull one Eliquis. I know that's what we refer to as a TV drug. It's an expensive TV drug. Eliquis has a retail cost of $550. If you had no Medicare insurance, you would go to the $550. Once you have coverage for retail cost of meds, and it's of $4,430 retail cost, you are now entering what there have been referred to in the past as the donut hole. The donut hole is a gap in coverage. So in 2022, that limit of retail cost was $4,430 before you entered the donut hole. And this year it's been raised to $4,660. That's does not mean that that's what you have paid out of your pocket. What I try to have people understand is when you purchase one of these standalone drug plans, you are now taken on a partner. You have, whether it's Cigna or Aetna or ClearSpring or Humana, you have now accepted a partnership with this insurance company for whatever your premium is. So in the early stages, the partner, okay, if you want to give $30 a month to join my plan, we now have to do a dance back and forth. In the early stages, you could not join that. Okay. In the early stages of our relationship, I'm going to expect you, the consumer, to pick up the first in 2023, $505.
One second, Kathy, can everybody be on mute, please? Yeah.
So the partner says to you, in the early stages of our relationship, I'm going to ask you to pick up the first $505 of medicines that are in the higher tier limits. You do your part. After we have after the retail cost of the meds that we're talking about have reached $4,660, your partner, the insurance company, steps up and takes control a little bit and says, okay, I'll now pay a little bit more for the time being until we reach $7,400, and then it goes into what they call catastrophic coverage. These are things, again, there's no one size fits all. We need to look at each individual's particular meds to see where and when they might come into these different levels of coverage. And that is all included in a review when we do this to help somebody make the decision of what plan is going to work best for them. Okay. There's going to be 24 plans available in 2023. There were only 21 last year. 4 plans have a 0 deductible. That means a 0 deductible. They have a much higher premium. You pay down, you buy down your deductible. It's just clear math. This is insurance. And the more you pay, the more we give, the less you pay, the less you're going to get. So 13 plans do not apply the deductible to all tiers. It usually is tiers 3, 4, 5. There are no 5-star plans available in the calendar year 2023. Now, the value of having the availability of a 5-star plan is that you would get a special enrollment if you had made the wrong decision or your prescriptions changed drastically and you needed to review, that was Desi, and you needed to review and possibly change the plan. A 5-star plan would give you a special enrollment, but there are none available this year. Okay, I'm not going to go into the 4 different plans that have changed. All right, I do want you to understand that when you search by putting in your meds on the Medicare Plan Finder, it's going to it racks your brain to try to understand. So that's why one of the things I ask my counselors not to do is don't ask me why, because I have no answers to why. But you can have one particular med and it's a different price between every different insurance company and every different pharmacy. So just because it costs $10 if you had the Aetna plan at CVS, that same med on a Cigna plan, if you went to Osco, can be completely different price. So again, looking deep into the individual situation to come up with the best plan for an individual. There's no one size fits all. Just because a husband and wife doesn't necessarily mean to be on the same plan. My husband and I are not, because I don't take any meds and he does. So it's all done by an individual's need, okay? This is just telling you how to do these are the different plans. Again, I'm not going to go into, these are the names of the plans, but within these 6 plans, there are 23 different plans within these 6 companies. So we have to look carefully between each. The special enrollment period I tapped upon. When you make these individual decisions during open enrollment to choose either your prescription plan or your Medicare Advantage plan, you're pretty much stuck in that plan for the calendar year unless you can qualify for any one of the different, what they call special enrollment periods. And there's all different kinds. They've now added one in 2023 for somebody who could not do their enrollment because of a weather disaster. That is now a special enrollment period. If you joining a 5-star plan was a special enrollment period, but they've sort of eliminated any 5-star plans this year. And one of the other special enrollment periods is on an income qualifier. If you qualify for some of these federal programs called Extra Help, LIS is limited income, they can give you some special enrollment period to change your coverage during the year. Again, talk with a Shine counselor, check to see if you are eligible for any of these plans. There are any number of them that you might qualify for to help reduce the cost of your out-of-pocket costs for your meds, okay? The drug search forms, which is the SEPs, are available after December 7th. Again, if you made the wrong decision during open enrollment, these are the even fewer special enrollment periods that allow you to make a change. One of them would be the 5-star plan. We talked about that. The Extra Help, which is a federal program, you would get that through Social Security, an application to Social Security. A Shine counselor can assist you with that. If you do have those particular programs, Extra Help and limited income, you can change your plan a number of times throughout the year. The Medicare Advantage enrollment period, we talked about it early on in the slides. That's a one-time step. If you thought you made the wrong plan choice over open enrollment, you can unwind that during the first quarter. And then there's a whole list of other SEP plans. But again, that's a counselor would help you do that. Okay, this is, many people will ask us, how are the stars rated? Now the Tufts preferred HMO plans, I'm going to skip back over this until we get to Medicare Advantage plans. Yeah, I'm going to go back to Medicare Advantage plans. All right, so if you join a Medigap policy, which is out of those 7 companies, and I can forward that information to Pratima for the Medicare 101 information packet when it's all put together. If you have a Medigap plan, you must join a prescription plan. There's no prescriptions on the Medigap policies. So now we're going to go into what they call Medicare Advantage plans. I believe in Norfolk County, and these are Massachusetts network plans. So every state has their own specific plans. I'm only talking about Massachusetts plans when I speak here. And I will pay more attention to Medicare Advantage plans in Norfolk County, because that's pretty much basically my base. I do have information on Plymouth County, and I can get it for any other county in Massachusetts if it was needed. But I will be dealing more with Norfolk County at this point in time. Medicare Advantage plans were plans designed because the Medicare powers that be up there on the and wherever they sit in the big world, they don't really want to be in the insurance business, so they sort of outsourced. That's the easiest way to explain how Medicare Advantage plans came around. You had Medicare Part A and B, and then they put in the prescription plans. Medicare Advantage plans is an interchangeable with what you might refer to out there as Part C. There really is no Part C Medicare plan. Part C is the umbrella over Part A, Part B, and D. That's what a Medicare Advantage plan is. So in order for the government to entice insurance companies to take on this type of plan, they had to sort of come up with a formula. So the insurance companies said, okay, whatever you're getting for somebody's Part B premium, you have to give us that money. And then, all right, so your Part B premium goes to the insurance company should you decide to go on a Medicare Advantage plan. You are no longer covered by Medicare. You are not on original Medicare any longer. You are now covered by a private insurance plan under Medicare Advantage. So you have to have Medicare to join, but you are no longer just a Medicare recipient. You are now a participant in private insurance plan under a Medicare Advantage plan. Okay. And those are mostly HMOs and PPOs. There's premiums, copays, and they can range. These plans can range from a zero premium, and that's what you see many times advertised on TV. Zero premium, get the benefits you deserve, get this, get that, get all of these other things. And again, I have a list of all of those plans, but I'm certainly not going to put up on the screen 41 different insurance plans. We'll touch on some of the changes when I move forward. But you have to be very careful when you are considering getting your health coverage through a Medicare Advantage plan. It works for a lot of people. It works perfectly for a lot of people. But I would have an alert button go off if somebody who had a chronic illness was considering to go on a Medicare Advantage plan, because they sort of control your health. It's an HMO, you go where they want, when they want, you pay co-pays, deductibles, and you have a large out-of-pocket exposure should you have, a bad health year. Some of these plans, even though they're zero premium, have an out-of-pocket exposure of $7,500 before the insurance company begins to pay everything. And I'm going to make that comparison to make it a bit easier to understand. If you bought yourself a new vehicle and you went down to your insurance agent and they said to you, oh, you don't have to give us any money, zero premium. What do you think they're going to do for you when you total your new car? Do you think they're going to give you a new one? Or are they going to make you pay mostly out of pocket? So it's a big decision. Again, sitting with a Shine counselor or somebody who really knows the advantages and disadvantages of these plans is very, very, very important. Okay. They are now having some of the plans which are going to be nationwide networks. And again, but you'd have to make sure that your doctor practiced in California and still accepted the plan. So again, I have to keep saying the same thing. Sitting down with an individual, trying to go over what's best for you is the way to go. If you join a Medicare Advantage plan and you are already on a prescription plan, it will automatically disenroll you from the prescription plan. You cannot be on both. It's an either or situation, because most of these Medicare Advantage plans do have some prescription coverage. All right. Your prescription costs do not count towards your out-of-pocket costs for your health insurance coverage. So if you're using a Medicare Advantage plan to cover your prescriptions and you have a $6,500 out-of-pocket maximum for health coverage, your prescription costs do not. You still have to have the exposure on the other end for your health costs. They do have extra benefits. Some of them have some dental, some of them have some vision, some of them will buy sneakers, they'll give you gym memberships. Every one of these insurance companies have different carrots that they put out to try to get people to enroll in their particular plan. Again, delving into the depths of each plan is the only way you're going to be able to see what all the benefits are. The major obstacle to these plans, and again, this is my opinion, is for people to make certain that the doctors that they want to continue to see take these plans. That is very, very important. So I would be able to sit with somebody and I can give you all this information, and this is going to be best for you financially. But if your doctor doesn't take it, you have to start finding new providers, getting new established relationships. So sometimes it's a very difficult situation. But again, we can dig through to see if your provider is on a particular plan, or you can't even call most of the doctor's office to get that information. I'm going to usually, because the receptionist in most cases is going to say to you, oh, we take all plans, but they don't take plan A1, so my response to people is I go the back door, and I always call the billing departments to ask them, do you take this particular plan XYZ 1, 2, 3? The billing department knows what plans they take, because they're the ones that get the rejected payments from the insurance company. So again, usually the receptionist doesn't really know the individual plans. Okay. Are there any other questions out there, Fatima,
I think that was a very good point you mentioned, because I was doing for my dad too. And I have realized that whether it's my dad or even for us, like going directly to the billing department made a huge difference.
Yeah.
Because like in our case, we use United Healthcare.
Yeah.
And when it comes to the HMO and PPO, and for certain vision, you have certain people using, certain companies use only Spectra, and
Right.
people who are in the billing, not the billing, but the receptions, they don't know any idea about it. And they say, yes, yes, yes. And finally you get a bill because it was there. And when you call the billing department, they say, who do you speak to? Which really makes no sense. And I'm like, why the company, the hospital should know, Brigham Women should know who am I talking to. And I already told about what we have, right? But they messed up. So that's why I was like, now we only talk to the billing department. That's, they are the right people. That's a very good thing you told. Like,
it's amazing, these little things, because you take the word, thinking that it's accurate information. So but it's only been or they put a wrong billing code on something. And one of the worst companies that I have come across that does a lot of this billing is Quest Diagnostics. I think they're very, very lax in providing the right codes. If the doctor's office puts code 123 and it's really should be 321, Quest doesn't care. They won't go back and put the right code in. So that's one of my bones of contention whenever a bill comes in or a complaint comes in. Quest. Okay. Okay, I'm trying to see what's important to point here. Okay, I'm just going to go to the next screen.
Before going, is it more sensible? I know I was just listening to all this, still there's so many confusion points in my head, but if a person can afford, I mean, there are two different parts here. If a person can afford, should he or she take Part A, Part B, and Part D to be on the safe side?
If a person cannot, to be 100% covered for health insurance, to put your head down on the pillow at night and not worry about anything, yes, A, B, a Medigap policy, and a drug plan. And you really, I mean, you might have a cost of meds depending on what meds you take, but you could put your head down in the pillow knowing that you have what I refer to as Cadillac coverage. Nobody's going to come chasing you for hospital bills. That's the perfect coverage. But many of us can't afford perfect coverage, because you're going to understand, we got $164.90 Part B premium. If the fellow that we were talking to on the others line now has a $506 Part A cost, if he were to buy Part A and then add $164.90 to that, we're now up to $700. If he was going to buy the best coverage at the Blue Cross, the 1A, he's going to be talking about another $190, and then a prescription plan. So we're looking at $900 to $1,000 a month in that particular case. The average, now he is not the average case, because most individuals that come through have their 40 quarters in. So the Part B in most instances is usually free. So on the average, and this is the average for somebody who was not making the big bucks, but put in their 40-hour quarters, the average would be the $165.90. If they wanted the best coverage, $190. But if they don't take a lot of meds, the least expensive plan, an average monthly per person would be probably $400 a month to be fully covered on Medicare. You can cut that $190 down by going on one of these 0 to lower premium Medicare Advantage plans. But if you constantly go to the doctors for various situations, you're going to pay $10, $15 every time you go to the doctor. You're going to pay $45 to $50 if you go visit the specialist. You're going to pay $350 for the first 4 or 5 days that you'd be hospitalized. So it could be much more expensive for the least premium plan. Again, none of us know, we don't have a crystal ball knowing what's going to happen to us in the future. But when we have to make this decision in between October 15th and December 7th, we have to only use the information we have to make it available. But again, if finances is the absolute driving force, there are Massachusetts plans that can help with prescription coverage. I know it's public benefits. It's called Mass Health in Massachusetts, and it's not just one size fits all. There are probably 15 to 20 different Mass Health plans at various income and asset levels that somebody may qualify for. So that is, again, one of the exercises when you reach out to a Shine counselor anytime during the year. They can go over all of that with an individual. I can't put the public benefit income and asset level out there for public display, but I know what it is, okay? So there's any different way to do it. Some of them would just defer the cost of the prescriptions. Prescription Advantage is a Massachusetts plan. Certain levels of income. So again, it's no one size fits all. I can't answer anybody's individual question right now. If they qualify, even at the max, if you had to pay the max of $200 to buy a special enrollment period to be able to change your plan, again, a sit down with the Shine counselor or a phone call with the Shine counselor on an individual basis, we can figure all that stuff out and find somebody the best plan that's going to work for them, okay, to supplement. On these Advantage plans, again, there are 66 different Medicare Advantage plans available.
Wow.
It's overwhelming. I tried to put a chart together that put all this, there was just no way I could do it. So this information is available to anybody who wants to go on to the Medicare.gov. Medicare.gov, it's called the Plan Finder. And you can set yourself up a Medicare online account. and it would go with, you need your Medicare number, the date you're enrolled in either Part A or Part B. If it's not already on there, Medicare, if you've been using Medicare to fill your prescriptions in the past, those prescriptions are already on that website. You would just have to tweak them. Did it do a different dosage? Does it higher or lower? Do I take 2 a day, 3 a day? Have I added any medicines since this was gone? Have I eliminated some medicines? And then the computer will churn that information with your zip code and pop up whichever is the least expensive of the plans for your individual need. And it works perfectly until they've made this ugly mess with the insulin. Because that insulin program came in so late, and under government regulations, these insurance companies had to provide Medicare with their drug prices by June 30th. And they were updated and ready for open enrollment with their new prices. But that Inflation Reduction Act changed all that with the insulin prices. Medicare has made the statement, we will not go back into that plan finder and fix those prices until the next open enrollment for the whole calendar year 2023. Those insulin prices will not be updated. So it's going to be a horrendous and chaotic situation for anybody. Giant counselors are overwhelmed with it because we're trying to figure it out. We're trying to put up a list of what insulins are covered under this new plan and which ones aren't, what insurance companies are participating in this insulin savings plan and which ones not. It's in the works. We won't have it for next week when open enrollment actually begins, but we will be working on it. So if you have anybody that's taking an insulin, have them talk to a Shine counselor and don't try to do this themselves, because it's just, the information, unfortunately, it's sad to say, is not going to be correct. People are going to be making the wrong decisions based on inaccurate information. But everything else within that plan finder is, I know my life is pretty low key right now, but I have fun on the plan finder. I train on the plan finder. You can toggle back and forth to look to see if once you've got your meds in there appropriately, do I want to go on a Part D plan? With my meds? Let me take a look at Medicare Advantage plans. You can toggle back and forth between the two different types of plans. The only thing I would tell somebody who is going to go on there on their own is do not click when it asks you the question, what type of plan are you looking for? You either select Part D, just the plain Part D, or just check Medicare Advantage. Do not check anything that says Medigap. Medigap will be part of our package, as I told you, but this is a national site. So it does not have the true and accurate information for the Massachusetts plans. So either look for a drug plan or a Medicare Advantage, but please do not use the Medigap click. That is, again, Massachusetts plans are not accurately reflected on that plan. There are plans, as you can see here, a brand new and Medicare Advantage plan, which really piques my interest, and I will be delving into that next week, is the Mass General Brigham's has their own Medicare Advantage plan. So I know a lot of people who, most of their physicians and doctors are in Mass General or Brigham's.
Yeah.
I am very seriously, going to consider that because I live in the Rentham area. Mass General Brigham is now right there in Foxborough, and I've been doing more and more of my health care right there at Foxborough. But I have one of those much more expensive Medigap policies. If this Brigham and Women's Healthcare serves my needs at a much lower price, I may consider going over to that. So I don't have the in-depth information on it right now, but it's coming. Each day goes by, the state is releasing more and more of this information because the open enrollment is just coming up. Okay. The plans that are called Part B Premium Give Back plans, they don't kind of, again, and I'm terrible. I have my own opinions about this unbiased information. A give back, they want you to buy into their plan and they're going to give you back a portion of that $164.90. None of those plans in what I've done for individuals thus far has come up as the best plan for them to join over the long term, but knowing that they're going to get $65 back of their premium has actually encouraged them to join that plan, even though I didn't feel it was the best plan with what the situation was currently. But again, I can only give information. I can't make anybody make the right decision for themselves. I just provide information, as all Shine counselors have to do. All right, and there's all 2023 Medicare Plan Cs will offer covered insulin. And now that's the oxymoron here. They have not given us the list of covered insulins. They, that should be the next list right here on this slide. These are the insulins that are covered so that we could do a search and eliminate when someone gives us the med list right off the bat. Okay. But again, hopefully it'll be in the works over the next week to 10 days for the Shine counselors. The HMO plans, there's some zero premium plans. There's some zero premium. These are all the different ones. It tells you where they're available. So if you gave me, again, these are network specific, area specific. If somebody's in Barnstable County down the Cape, I can access that information if I need to, but I don't have it readily available. These are the different counties that plans are available in. So you might talk to somebody and says, oh, I have this and it cost me this. Doesn't necessarily mean that's available in your zip code. So people living out of state, I don't have access to any of their information. It's all state specific. A few of them, Aetna and United Healthcare, are now starting to have their network nationwide, but it's so new. So if you were traveling to Florida and you were on the Aetna plan here in Massachusetts, you could go onto the Medicare.gov website to see if there is a provider in your area in Florida that accepts the same plan if they've now joined the network. But again, in past, there's been no network, no national network. It's been, if you have a Massachusetts Medicare Advantage plan, you are covered only in your state unless it's an emergency. And if you were in an automobile accident down in Florida, you would be covered if you had this plan for the emergency. But if you had a state for the follow-up, you would not be covered. Again, a lot of decision goes into deciding these Medicare plans. I'm not going to, so these are the different companies that sell Medicare Advantage plans in Massachusetts. Aetna, Blue Cross, they have 3 or 4. See, they've got 7 different plans. Aetna has 3 different plans. Blue Cross has 7 different plans. All the different PPOs, I'm going to keep going. Eternal Health, and again, I sound like a broken record. I don't know anything at all about Eternal Health as an insurance company.
We have here with us Narayan Sharma, who is from Eternal Health.
Okay. Okay. I don't know anything about it. I've never met with any of their marketers. I don't know anything about the plans themselves. You know somebody from Eternal Health?
Yeah, Narayan Sharma, who's there now in the call, he works for Eternal Health.
Oh, okay. So maybe you can give him my connection so that I can learn a little bit about it. I know absolutely nothing about Eternal Health.
So Narayanji, you can connect with Kathy. I will share the info with Kathy and you can share with her.
Perfect. Thank you. Thank you. Fallon is another one that's reaching out to the different networks. Mostly they're
Fallon, Kathy, I take Fallon for my father.
Okay.
But my dad is, of course, he takes Medicaid, and I've taken Mass Health, have moved it to Fallon Health. It's really good.
But I don't know, but the orange plan has been discontinued and they'll be moved to an orange, a Medicare plus orange or some other. plan. So they discontinued one of their plans. So every year, and I'm going to keep going back to that fellow who asked about at age 53, what's his options are. Everything changes so drastically from year to year. Okay. Health New England is another one with 7 different plans and 2 PPOs. So there's homework to be done. Humana has plans, and they've recently expanded to the north, to the Suffolk County. We're not going to go into the details of each of these plans unless we're sitting with somebody specifically and it comes up as one of their best plans for them. And then we would dig further into the plan to see how it works for that particular individual. Massachusetts Advantage is the name of another plan. And I know that's going to cause my counselors a lot, because people are going to say, I have Mass Health, and it's going to, or I have Medicare Advantage. And it's just the name should be something different from that, you know. And here's the Mass General Brigham's plan that I will be looking further into. Again, I don't want to insult Eternal Health, but I've been looking into Mass General Brigham with my own convenience. That's what's going to be available. So the 2 PPOs is from $0 to $40 a month, or the premium for their HMO is $52 a month. And again, I'm going to look further into it. Is that Molina Healthcare, Tufts, and United Healthcare? Those are the WellCare. Those are the companies that are selling the Medicare Advantage plans in our state of Massachusetts. Okay. Medicare Savings Accounts is a consumer-directed Medicare Advantage plan. You don't hear very much about it. It's similar to anybody who might have been working and has a health saving plan outside in their employer. You can go to any Medicare provider. Medicare will put certain dollars amounts away into these plans for future use for medical reasons. The Medicare savings plans cover medical services that all Medicare Advantage plans must cover. You cannot be eligible for Medicaid or receiving hospice benefits. The Medicare savings plans do not cover your Part D coverage. You can join a Medicare savings plan and a drug plan, and you have to have the standalone drug plan. This is the only one company in Massachusetts that sells this, that has this type of plan, Lasso. It has not been, from everything that I understand, has not been greatly received in the state. I've not had to deal with anybody who actually has worked with these type of plans. They're going to continue to make this. Medicare will make these deposits on behalf of the individual on an annual basis, and it can be used for out-of-pocket expenses. I don't have any connection to Lasso. No, Lasso, even though I've emailed a couple of times, I have not gotten a response from anyone of the marketers. Yep.
Kathy, quick question. This savings plan account, do people have to take when they are coming close to 65, or they can do in their early 50s?
No, you have to be 65. You have to be Medicare. This is a Medicare savings account.
Okay, but they have to be 65 to even start this savings account.
And on Medicare, yeah. Yep. There's special needs plans for people who are in a long-term care facility. They can buy specific plans. Again, an individual conversation if someone's in that situation, along with the Mass Health, possibly conversation about being on Mass Health if somebody's in long-term care. It's a much more in-depth conversation on an individual level when we're in this type of situation. But there are a couple of special need plans available. Okay, Part B. I think we've probably all experienced this in some way. If you had a knee replacement, you first had to get your shots of cortisone, then you probably had to get the step for the gel before they would even consider doing anything else. So that's step therapy may be required within some of these insurance companies. And again, as we delve into the details of a plan that somebody would be considering, we would look at all that. That's step therapy. We've already done the Part D plans, and I'm going to skip through that, see what else we have here. Special enrollment periods, we've done that. So thanks for staying with me. Medicare Plan Finder. This is the fun part. The Medicare Plan Finder is where all of us can go, any of us can go to search what plan may work for us. And I touched on it earlier. You would have to go on to Medicare.gov, set yourself up with a Medicare online account. It's not your Medicare claim number that's on your red, white, and blue card. You have to set up a username and password, and you have to answer a secret question. Just brand new is now they've added that multi-factor authentication. It's on a voluntary basis, so you please kind of make note if you actually turn it on or turn it off, because if you go to a Shine counselor or you submit the drug search form for Shine counselor due outside of a one-on-one, we had it come up the other day. We've had a simple able to log on and search people's needs, but now with that multi-facet authentication, we have been unable to get into a few accounts without the text will go to the client. The client's not calling us back at a proper time and then is leaving a voice message or an email. So it's causing Shine counselors a little bit of angst, but you can turn it on or off, but it took a phone call for well over an hour at Medicare to shut it off with the particular client. So again, make note if you have put that on when you do set up a Medicare account. Mm-hmm. It gives you the estimated cost for in-network pharmacies. I'm trying to see if I have a detailed page that you could see it exactly what it is, but I don't see that. I'm going to go back again. Go back. You can search drug plans. You can search Medicare Advantage plans. You can actually see what your claims are. You can turn off if anybody doesn't like getting all of that paper that comes in about your explanation benefits, what Medicare may pay, what they won't pay. You can opt to have all that on your online account. There's a lot of information you can click on when you're in there into any number of the information pages that CMS has, how to appeal a billing error, how to do this, what to do, what's covered, what's not covered. It's a wealth of information on the individual basis. So you can actually do a lot on that plan, on the plan finder, I should say. Okay, and here's a reminder that you'll see, we never make recommendations on exchanging prescription medicines for generics or anything else like that, because we will have a lot of consumers. Well, if it might show that if you change this med to that med, because I've got a few Shine counselors who are pharmacists, and they get hung up on that. And the rest of us are just laymen, we don't know that. So we cannot contact the client and say, you should talk to your doctor about changing the meds. That is not something within the realm of a Shine counselor, but we should all be advocating for ourselves and asking those questions of our physicians. Is there another med? This is costing me a lot of money. Is there something that I can use in replace of that and get something changed? Because you will find if you do go into this plan finder, the formulary will say you can only have 30 in the course of a day or the course of a month, but the doctor's prescribed 2 a day and it's not going to cover us for 60. The doctor has to intervene and get the insurance company to do a bypass on that. So there's a lot of little innuendo things that we just can't seem to see on that drug plan. A lot has to do with talking directly with the individuals. Okay. What do we have next? And here it is, choosing the plan. You create the account, you enter the drugs. You don't put Part B drugs. If you are taking a cancer drug that you go to the hospital to be infused, those are not Part prescription plan drugs. Those are covered under Medicare Part B. If you're having an insulin that's going to the doctor's office to be administered, or a hospital setting, that is not a Part D drug. So that adds a little bit more confusing to people's input of the data. You have to be specific on whether you put a tablet or capsule, because it's going to default to one certain, but if you take a tablet instead of the capsule, you have to make sure on that drug plan that you do change it, because the same med at the same dosage, same milligram and the same daily intake, a tablet and capsule can be hugely different in prices. So if you put down capsule and it really a tablet, it can be skewed. So those are things that we have to watch for. We do, and I will send it to Pratima, have a form called the drug search form. And I don't believe it's on this presentation, but if I could probably stumble through and find it on my thing. All right, here we go. This is something for Shine counselors, but again, I will reiterate, because we've touched on these things. If we're working with any kind of insulin, we have to make sure we have the right insulin, because of this little quirk that's going to be in the system. We have to keep a big alert out for anything on the insulin. It's okay. The Inflation Reduction Act has changed that. And here's the actual, you get to see the actual information that was provided to us. The annual bid process, and this is why the 2023 insulin prices are not going to be correct. The annual bid process requires submission in June before the Inflation Reduction Act was passed. Once approved, the plans are not permitted to change the drug tiers or their formulary. The plan bid information is used to populate the Medicare Plan Finder cost sharing and coverage details. As a result, the Medicare Plan Finder cannot be updated to reflect those $35 co-payments for the insulin this particular calendar year. So we're going to be fighting this issue all of 2023 for anybody who's on insulin. All right. This is just a hint for counselors on how to find the insulin. And I'm going to touch upon some of the special prescription alternatives that there are. If you have a very expensive med, you want to see if you can use a Good RX coupon. You cannot use a Good RX coupon and your Medicare Plan Finder insurance plan. You cannot use both. It's an either or. You're either going to put it through your Medicare prescription plan, or you're going to use a Good RX. You can't do both. One of the things that may sort of skew is Medicare does not know then that you have filled a prescription outside of the Medicare world. So it does not count towards your donut hole numbers. If they cannot monitor the cost, it does not count towards your donut hole. So it can skew things. Single care, needy meds, those are all various prescription plans that are out there. Most of the major pharmacies include them. You can download the app, as most of us know. And here's the little reminder of what I just said, that it will not count towards your Part D out of pocket. All right. I'm trying to see. Okay, these are just the different things to be watching out for, and we touched on them. If you do use the Plan Finder yourself, if you play around with it, you've got to check these certain things that are embedded a little deeper than what comes up on the comparison chart. There could be prior authorization needed for a particular med. It might have quantity limits. And in my instance, I can do an example. I had somebody who was on omeprazole, and they were on a 20 milligram omeprazole once a day. And then the doctor changed it to twice a day. They would not cover the 60 tablets in 1 month, because there was a limit on that of only 30 in a month. So she had to go back to the doctor. The doctor upped her milligrams to a 40 milligram capsule once a day, and it was covered, but the 220s in the course of a day was not covered. These are the little twerky things that you have to watch for. Okay. And this is just the details of things that Shine counselors have to do. And again, this is not something for public. This is all for Shine counselors after that. I will send to Pratima what we call the drug search form. And I can send that, and that is a form that we fill out, we send out. You've got to put your name, your date of birth, your Medicare information, your address. It fills up a little bit, it either gives us permission to set up that Medicare account for you, or you provide the information yourself if you've already set one up. And we ask for a list of all the meds, so that we can search to see if you either are currently on the right plan, it's something you should stay on, or if you're going to be a new enroll, which was the best plan for you. And we don't do those because we have hundreds and hundreds and hundreds of those coming in over the course of a week during open enrollment. We really do those on the side, and then we'll contact you either by mail or by telephone to say, this is what we found. If you want, we can enroll you. If you want to do it yourself, we'll give you the plan number and the phone number to do the enrollment yourself. The forms get mailed back to HESCO, or you can go and pick up the form at your local Council of Aging if you're within that region here. Hopkinton is not one of my councils, that's Middlesex County, but I'm sure they have the drug search forms that would be for people in that area. But if it's, Shine counselors are volunteers. And as you know, everybody's a little bit different. Some Shine counselors, because we do get so overwhelmed, will only take people in the town that they cover. Others will just accept an application from somebody from any which direction. So if you send it back to my office, we will just deal with it that way. But, if you sent it back to the Sharon office, the Sharon counselor may say, I'm not going to deal with somebody in Norfolk, have them send it to Norfolk. We are all overwhelmed, and we only can take on as much as we can take. So that's how they set their parameters. But I can be reached at kchianka@hesco.org if you have specific questions. I will, soon as I get my Medicare 101 summary in good order with everything for 2023, I will send it to Pratima, and I can have it printed and sent out or emailed, however you want it. Sure. So do we have any other questions there, Pratima, that someone might?
I think, I don't know if anyone in this group has any questions can ask, or we can just email me. You can just email me at pratima.penumarti@volunteeringforseniors.org, because the time is running. We're already crossed the time, Kathy, for now. But what I would say is that Subhash and Murthy, if you have any questions, please feel free to ask Kathy now, or we can just, right.
Thanks. Not right now. I'm just taking in the information.
Sure.
Perhaps,
If you have any questions, Subhash, please email me directly. It is pratima.penumarti@volunteeringforseniors.org. You can just send me that, and then I can forward it to Kathy. I think that quickly, because so many things today we all learned, and we all are listening about. It's a little overwhelming, and almost very overwhelming. But yeah, not little. A lot of things we'll do a research on. But I think the takeaway, which I felt, Kathy, is that, and I correct me if I'm wrong, that there's also more limited Medicare Advantage open enrollments, right, from January 1st to March 31st. When members can switch Medicare Advantage plans or change to original Medicare.
Yes, exactly.
Right? And only one change is allowed during that time.
Correct.
Right? And I think another takeaway, which I learned now, is that Medicare beneficiaries can make changes to their coverage during special enrollment period.
If they qualify for special.
Yeah, that's another thing too. And members can decide to keep the same plan if it's still available.
If it's still available and it works, yes.
Right.
There's nothing you have to do. Yeah.
Right. There's so many takeaways from this talk. I mean, there's so many things I know you also mentioned about that. Basically, if they want to, if people know that, if they need to change a plan, right? If at all they have to think about it. That means if their plans are changing, then they should make sure that their plans still meet their needs for the
Oh,
next
yes, oh, yes, oh,
year.
yes, yes. Because the insurance companies can walk you over to a different plan, and that walkover may not be the plan that's gonna serve you the best, or it may not fit within your financial, you know,
Right.
we just walk you over, yeah.
That's very nice. I mean, that's so many things these are things which I was trying to accumulate and put, and then I think let us all remember, and this goes to all the viewers who will later on watch it too, is that when we need to remember that low monthly premium may not always be the best overall value to meet one's specific needs, right?
Right,
Not
yes,
be
not
And-
be,
correct. And then also, if someone is selecting any Medicare prescription drug plan, they need to check if their prescriptions are included
Mhm.
their plans. I think, what do you say that, Kathy? Plans formulary or
In the
something,
formulary, correct, it'll correct.
right? So those
Yeah.
things. So
If there was another webinar where we could walk through a Medicare Part D plan and how to
sure,
find the information, you know.
I think we should do that.
Yeah.
Definitely do that, because Part D, with so many parts, sometimes I think each part should be taken separately.
Yes, exactly.
Talked about it in detail. Part D is something many people be confused again. So that's another
Right.
thing. Definitely take it.
And I would say that, except since mid-August to now, the plan finder, I was gonna do a training on it. Every day has been tweaking and changing a little bit. This button is now over here, this one's not here. So again, once it's in shape and it's gonna stay that way, then you can actually have a training on it.
And I think the last one, which I, again, hearing from you is that, Kathy, is that if anyone takes insulin, then there is a new
Oh,
out-of-pocket cap,
yeah,
right?
yes,
The supply of each insulin
yes.
product they take
Right.
when covered by a prescription
Some
plan.
of the insulin plans, $35 is gonna be the max for
Right.
select insurance, for select insulins. I don't know what that list of select insulins, oh, my daughter just walked in with her dog.
Right.
If and when I have that list, I
You
can,
can separate, yeah, you can send that. Actually, Kathy, it would be great if you can email me all that info, and also I can put it on the website under resources
okay,
for people to know about the Medicare 101
Yeah.
thing, you know? And the final thing is definitely is the Biden-Harris, the administration, which has been talking about the health insurance and lowering the health costs,
right,
right, for America. But again, we
Yeah.
don't know. Let's wait and see. So
Yeah.
many changes happen.
so much happens all the time.
So many, it's so confusing, but it's nice to hear. It's good to learn all this. And I think just to end today's, I would say that thank you very much, Kathy, for really giving
Okay.
us so much of knowledge, so much information. And our organization's goal here, VFS organization's goal, is to connect people to resources like this and promote aging with independence and increase community awareness of aging issues and generate community-based solutions to those issues. So
Okay.
again, thank you, Murthy,
Thanks, Mithika.
Vash, and thank you.
Thank you.
Thank you.
Thank you, Pratima.
I'm, my daughter and her dog and my grandson just walked in, so I'm
Oh.
perfect timing. I'm gonna head out. Okay, thank you.
Thank you.
Thank you, everyone.
Bye.
Bye.